Percutaneous posterior lumbar interbody fusion, percutaneous PePLIF. This novel concept to lumbar interbody fusion combines two emerging technologies in spinal surgery. 1. Ultrasonic bone and disc removal, and 2. Expandable interbody cages. In percutaneous PePLIF, the surgeon can access the lumbar disc percutaneously, minimally invasive and with the use of a wide range of navigation options such as C-arm fluoroscopy or more advanced CT MRI-based systems. This is how it works. Through two paraspinal incisions, right and left, the surgeon advances two Jamshidi needles or pins to the recognized percutaneous PePLIF work-safe area and lateral disc space. To do so, the needles are advanced under navigation to the facet joint above the inferior pedicle, then through the lower aspect of the foramen and ipsilateral disc space. Then, percutaneous dilation of the posterior soft tissues is carried out, and the final soft tissue dilator is locked onto the facet joints bilaterally, perpendicular to the spine. Ultrasonic bone removal and aspiration of an 8 to 12 mm cylindrical pathway in the facet joint occurs into the lower foramen. Alternatively, a perforator drill bit can be used to create the cylindrical pathway. Once in the foramen, sequential disc dilators are docked onto the posterior disc, and the disc dilators are angled a few degrees inwards. Ultrasonic disc removal and manual disc and cartilaginous endplate removal of the lateral disc is achieved. Expansion and sizing of the disc space is obtained. The expandable interbody cages are introduced, expanded, and filled with bone graft. Both cages, right and left, are located laterally against the stronger apophyseal rim of the vertebral endplates. Posterior instrumentation with pedicle screws is achieved as the last step. All of this is performed percutaneously, without opening, exposing, or retracting the dural and nerve elements. This is a major paradigm shift from conventional open and minimally open approaches to lumbar interbody fusion, such as ALIF, DLIF, PLIF, TLIF. Percutaneous PePLIF offers major advantages, including reduced surgical time, single prone patient positioning, reduced tissue manipulation and/or disruption, solid bilateral interbody support, anatomical reconstitution and fusion, avoidance of abdominal, lateral, and oblique accesses and their related side effects and morbidity. Easy to use by most surgeons familiar with percutaneous placement of posterior spinal instrumentation. Cost-effective approach utilizing readily available navigation systems, C-arm, CT MRI guided, equipment and instrumentation. All of which would translate in less blood loss, less post-operative pain, shorter hospital stay, shorter recovery, overall improvement in cost, widespread use in inpatient and outpatient settings.